Hey there, this is Joshua Warren at Connecticut River Acupuncture. I wanted to make a short video today discussing the major differences between community style acupuncture and private acupuncture. I'm going to sort of list these off right here. In community acupuncture, there are often multiple people in the space getting treated at once. The treatments tend to be shorter, around 45 minutes. They're more impersonal. The practitioner has less time with the patient, usually a couple minutes. The intake usually lasts only a couple of minutes. However, the treatments tend to be cheaper, which means that you can come in more frequently. You can come in, 4 times a month at a cheaper option. However, the treatments tend to be more general since the practitioner doesn't have as much time with the patient, which means that you are getting more treatment over the course of time potentially, but the practitioner has less time to really see and evaluate you. So in juxtaposition, the private treatments tend to be more personal. They're one-on-one. They are longer treatments, usually about an hour, sometimes an hour and a half. They're more dynamic and integrated. This is the style that I practice. You're able to see patients in a much deeper way. I spend a lot more time with my patients than one might be seen in a community setting. And this translates to more effective and longer lasting treatments. Whereas, in community acupuncture, you may be getting more quantity of treatments coming in more regularly because they're more affordable, but you then have to come in more frequently because they're not as integrated or deep. They're relatively in private practice. They are relatively more expensive treatments, but you will have to come in less frequently over the course of time. With private practice, we're covering more bases. We often talk about the difference between, in terms of a condition, the root cause versus the branch cause. Usually the symptom that you're coming in for is the branch of an issue, but when you're coming to me, primarily we're going to try to understand what the root cause of the issue is, and we may be working on your symptom, your branch issue, but the primary focus, and this is something that we learn over time, is what is the root issue of your condition. Because if we can focus on that and understand what that is, then we can essentially convince the body to release that root issue. Treatments in private practice, because of that, tend to be more specific. In juxtaposition to community acupuncture, you're often only working with like a primary practitioner, whereas in community, often you're having multiple practitioners that you're seeing depending on the week or even the day of the week that you're getting treated. So maybe you're coming into community acupuncture every week, but maybe you're seeing a new practitioner every week, which means that they may not be able to understand the nuances of your particular condition. Whereas when you're coming in to see me every week, it's just you and I am assessing how you're presenting over the course of time. I'm getting to know who you are on a much more deeper level. And then in private practice, there's also just a lot more access to the body. In community settings, usually the setup is you're in a larger room and you're on what are called anti-gravity chairs, which look like lawn chairs that kind of recline. But in a private setting, usually you're on a table. In my office, you're on a table, and I am able to have more access to your body, the front of your body, your abdomen, your arms, your lower back, your entire back. Patients are not completely disrobing. Usually I'm getting access to the lower back, sometimes the mid back, the abdomen, the arms, the legs, whereas in a community setting, usually they're only accessing the wrists, the legs, and the ankles. The other aspect of private practice is that we're able to have much more customized herbal formulas, because I have the time to be able to not only assess the root issue as well as the branch issue, but also cater an herbal strategy that supplements and supports the acupuncture strategy in a much more dynamic way. And that is something that I have the time and the space to be able to adjust as the weeks go by. So ultimately, those are the primary differences between community and private practice. Again, private practice or coming in to see me one-on-one, it is a little bit more expensive than going to a community setting. However, the results are much more long-lasting, and in many cases, the root condition we're completely or at least significantly ameliorating. So really the choice is yours. It comes down to what your budget is and your sort of level of commitment to your condition. And there are a lot of spaces in between those two factors, and that's something that that we'd be able to work with, even if it means you're coming in once a month to see me. We can still do a lot of great work. Thank you for your time today, and thanks for watching.